Starting in 2014, all Americans were required to have health insurance under the Affordable Care Act, and many states, including New York, brought in companies to help insure people.
Yeah, we found out one company is out of business because it couldn't keep up with the very low competitive rates approved by the state. That left thousands of people without coverage.
And in tonight's New York State Exposed report, Amanda Shivari looked into why the state signed off on the low rates. Amanda?
Well, Janet and Scott, Health Republic was created in New York State after the Affordable Care Act. The whole idea was to create competition and keep the rate you pay each month for coverage low. But the rates were too low and the company closed, leaving thousands of patients without insurance. And I found out that the state actually approved those low rates.
I chose Health Republic mainly because they had small premiums.
Jennifer Williams of Holly is one of 215,000 people across New York State who signed up to get their health insurance through Health Republic. Their prices were low. Take a look. For the same plan in Rochester that other insurers were charging between $330 and $380, Health Republic was charging $271. But healthcare professionals say those rates were too good to be true.
Health Republic lost a lot of money because it was of its own mistakes in setting the premiums too low.
Health Republic closed in November with little warning, leaving people like Williams forced to rush to find coverage.
In November, I had to pay the premium for Health Republic, but I also had to shell out an additional $120 to get Fidelis. It was a choice between, do I make my car payment or do I pay for health insurance so I don't get penalized by the state?
All health insurance rates have to be approved by the State Department of Financial Services. And after emailing them for several days, I heard nothing back.
The point is, it passed unanimously.
State Senator James Seward chairs the Senate's Insurance Committee. I asked him how this could happen.
The Department of Financial Services, in my estimation, did not pay attention to the solvency of the plan.
Do you think the state failed when Health Republic was setting their premium?
Yes, I do. Something went terribly wrong.
Seward says that Health Republic didn't have a realistic business plan and the state should have caught on to it. As a result, thousands of patients are left rushing to find coverage, and about $2 million in doctors and hospital bills are sitting there unpaid.
Especially for the smaller offices. I mean, having $5,000 or $10,000 worth of income that just isn't going to come through the door when you provided the service is significant.
These doctors and hospitals are now left with the bill after this collapse. What happens to make it up for them?
That's a serious problem. I believe that the state should stand behind these claims and get them paid.
He wants to see the close to $2 billion coming to the state from bank settlements this year to be used to pay off the unpaid insurance claims. And he wants the state to make changes so this kind of health insurance collapse won't happen again, something Williams also wants to see.
I feel they made a fool out of themselves and hurt us and the patients in the long run.
Exactly what Senator Seward wants to see on a state level to make sure health insurance providers are setting realistic rates and that you can count on your coverage being there when you actually need it. Scott?
Well, Amanda, people may hear this report and have questions about their very own coverage. What should they do?
Well, people who have questions or concerns about their coverage can always call the New York State Health Marketplace at the number on your screen. It's 1-855-355-5777.
Amanda Shivari with our report tonight. Thank you.